Hello everybody and welcome to my channel. This is Dr. Mridula V. Amarnath here. So like I promised, I said I will come back, reply to all your questions. So I've made a series of videos wherein every day I will be discussing 5 questions with you. So I'll pick these questions based on the people who asked me repeatedly multiple times, which I also felt was, yes, it is important to discuss with you. Like I said, I'm a doctor, so I have also studied about this practical experience. I have given patients advice. But let me tell you, when I myself had to go through this situation, when I had my pregnancy journey, I still had so many doubts, so many queries. When I had to breastfeed my baby, again, it was, which was better? Is that better? Is this better? Is this enough for my baby? Is my baby getting enough sufficient milk? I had a lot of queries. So, but then thankfully I had my mother and my sister who would always guide me and help me through, because through their experience. So I thought I should discuss with you based from both from a doctor perspective as well as from a mother perspective. So stay tuned and let's move ahead. So the first question is, how much should a newborn baby weigh? So the average weight of a baby who is born after 9 months, or say after 37 to 40 weeks, should range somewhere between 2.5 kgs to 4 kgs. Now, if the weight is generally below 2.5 kgs, then we call it as a low birth weight baby or an underweight baby. Now, in case of premature or preterm babies, the weight is definitely lower than the normal range, right? So most premature babies range from around 1 to 2 kgs. Now, the newborn weight depends on a lot of factors, including the health of the mother, whether she has suffered from any disease during pregnancy, diseases or insufficiency of the placental circulation, the number of children the mother has had, genetics, family history, the number of weeks after conception, that is the baby is born, etc. So you must be wondering, is it important to, be born with a normal birth weight? Well, yes. Because if you notice, studies have also been conducted to show that kids who are born with a normal birth weight, that is above 2.5, generally have a very good growth and development in future, and they're also prone to a lesser amount of infections, lesser chances of infections than compared with kids who are born below 2.5 kgs. Because their immunity is still developing, they're a little weaker, and then they're prone to infections very quickly, and this can again have an impact on their growth and development. Hence, it is important to have a good birth weight. So the next question is, can I breastfeed my baby if I am taking certain medications? Of course, no mother would want to do anything that is going to harm their baby, right? But there are certain conditions or certain times when even the mother falls sick during her phase of pregnancy and even when she starts breastfeeding. So certain medications, like simple medicines that we take for fever, cold, cough, hypertension, diabetes, vitamins, mineral supplements, and now these medicines are absolutely fine. The mother can continue with these medications. But certain other medications, like those which are used for certain psychiatric illness or drug hormone altering medications, or those medications which are used to treat cancer, these medicines are certainly not helpful for the baby. It is certainly going to be harmful to your baby, both even while you're breastfeeding and even while the baby is inside the womb. Okay, at the most, personally, I would say as much as possible, if you can try out simple home remedies, like say if you've got a cold, make sure you do a simple steam inhalation. Or if you've got a cough or a throat pain, do simple things like salt water gargling, steam inhalation, applying wicks. All that would be of great use. But if you feel, it is not subsiding even after taking these medications, then only go for taking medications. But let me be again very clear. Even if you're taking a simple antibiotic, do not self-prescribe. Make sure you go to your doctor, because certain antibiotics which contain chloramphenicol is certainly not safe for the baby. So in such situations, make sure you consult your doctor once and then go ahead with taking medications. Next question which a mother asked me was, how do I clean my baby's ear, nose and tongue? Well, and as an adult, it's something that we do regularly. We make it a point to clean our ears, nose, tongue very frequently, right? Because that's how we feel. We feel neat and clean. And we want the same with our babies also. But let me tell you, do not even try that. You must have noticed that their tongue appears coated. But even after you clean, probably after 2 breastfeeds, it will be the same. So do not try to meddle with their ears, nose and tongue as much as possible, because one, the organs are very sensitive. So a little damage or injury can actually make things worse, and it can also make them prone to infections, and probably they would have a lot of pain. And they're so small that they won't even be able to convey that to you, which will again be difficult. So as much as possible, even if you're trying to clean, be extremely gentle. But I would say just stay away till they're at least more than 1 year of age. Till 1 year old, just make sure if you're cleaning their teeth, you can use a small cloth and then wipe their gums. But otherwise, do not touch their tongue, your ears also, and their nose. So many mothers ask me this question: is it safe to give honey to my newborn baby? I mean, will it be okay for my baby? I'm not sure. Maybe it's a practice in some places, but I don't know why this question keeps coming up. I think I've also shared this question in another video. It is, why is it safe to give honey to your newborn? I'm not sure. Probably it's a myth or a custom, like I said, in certain places where they believe that giving honey to their baby is good for their health, growth, development. Some of them, let me tell you, some of them, what they do is they even dip their pacifier in honey and then, give it to their baby. I'm not sure whether it is really required, because certainly honey is not a replacement for any sort of food at that particular age of the baby. When the baby is a newborn, it is not any source of food. Secondly, it is not going to have any useful or beneficial effect to the baby. Thirdly, honey also contains a certain bacteria which produces a toxin, a very, very harmful toxin called as botulinum toxin. Okay, now in case if the honey which you're giving contains this bacteria, then it can be extremely fatal to your baby. Very, very dangerous. It can affect the digestive system, because the digestive system of the baby is still developing. It is still not mature enough to fight against this bacteria. So what happens is it can affect the digestive system, and it can also eventually affect the nervous system of the baby. Probably after the baby is 1.5 years of age, when the digestive system is also mature, but it can fight against these toxins, then maybe you can start. But personally, I would never recommend parents to give honey to their baby before they are 1.5 years of age. So next, a very interesting question which I thought was, when is it safe to pierce my baby's ear? So I would think that in olden days, people didn't look into such minute details. When is the ideal time to do that, to do this, right? So when they found that the baby was healthy, the baby was feeding well, no such issues, then they would go find an auspicious day and then pierce the baby's ear. And probably in a day or two, the baby was absolutely fine. But nowadays, we parents are a little more concerned because we're a little more aware of situations. So the most common worry of piercing ear is one, the infection that can happen, hepatitis B and tetanus infection. These are the 3 things that we're very concerned about. So generally, most mothers nowadays are given 2 shots of tetanus toxoid during their pregnancy to protect the newborn from getting the disease. Along with that, the hepatitis B status is also checked during pregnancy. And the baby gets its vaccination for hepatitis B at birth and for tetanus by the time she is 6 weeks old. So after the full course of 3 hepatitis injection is completed, by usually around 6 months of age, and after those tetanus vaccine is also completed, usually between 6 weeks to 14 weeks, it is reasonably safe to proceed for ear piercing. So what I would recommend is that make sure when you're getting this ear pierced that it is done under safe, clean and hygienic environment. Okay, and make sure that your baby is being vaccinated, because these 2 are the infections that are quite dangerous. One is hepatitis and one is tetanus. So once these 3 things are carefully looked into, then I don't think you should be really concerned about. And secondly, if you notice any sort of redness or swelling in that area, then immediately consult your doctor. That is extremely important.